57-year-old Brian Stafford thought he was in great physical condition. A former Secret Service agent and the director of the Secret Service from 1999 to 2003, Brian ran 10 miles a day and didn't have any noticeable symptoms of declining health.
In the Secret Service, I took a physical fitness test every 3 months for 31 years, so my fitness level had to be extremely high.
However, with a strong family history of coronary disease, his doctor suggested a cardiac catheterization. To Brian's shock, it revealed 4 blocked arteries to his heart.
One of my blockages was close to 80%.
While Brian didn't need surgery immediately, he didn't want to put it off. So he set out to find the best surgeon for his condition. And, given his 31 years in the Secret Service, he knew how to do his homework.
My due diligence was extensive. I knew I was going to have surgery, I just had to figure out who with.
Brian was one of the 15 million people in the United States who have surgery every year. Some operations relieve or prevent pain. Others can change the course of a disease or improve the function of the body.
You know, all of us, when we go through life, probably going to have an operation someday. And you better, when that happens, you better be prepared.
So then, assuming you need the operation, how do you go about choosing the right surgeon?
First of all, you want to make certain that the surgeon that you've been referred to is experienced in the area, for example, where you have a problem.
Dr. Thomas Russell is the executive director of the American College of Surgeons and a practicing surgeon for 35 years. He believes that a patient should meet with their prospective surgeon many times.
You need to go and ask that surgeon penetrating questions about how often you do this, what the results are, and all those sort of questions you need to have in your mind before you go and have that visit.
Brian Stafford's search for the right surgeon led him to Dr. Douglas Boyd.
What I love to say, I'm happy when patients look into our institution. I'm happy when patients look into my record and me personally, because I know the harder they look, the better we look, and I welcome that kind of scrutiny.
Dr. Boyd is a cardiothoracic surgeon at the Cleveland Clinic in Weston, Florida, and specializes in all types of heart surgery.
Surgery is not something that somebody does to a patient. It's a partnership. You both have to get through this. You have to really be a team in order to have the best opportunity for success.
Brian and his wife had several in-depth interviews with Dr. Boyd until eventually they knew they'd found their surgeon.
He was always patient, always clear, always answered all of our questions. I mean, I asked him everything from, how many have you done, to what his academic credentials are. I got into his personal life. I want to know all about that. And basically I learned that he's as good as there is. There's none better.
Brian chose Dr. Boyd to be his surgeon, and the operation was a complete success. 2 years after his surgical procedure, Brian is running 5 miles a day with as much vigor as ever.
Surgery does not have to be necessarily a negative experience. What you have to do is keep thinking positive. This is a good, you're going to move forward, you're going to get on with your life, you're going to be prepared, you're going to cooperate, and use this as a stepping stone to living longer or feeling better.
I've got another gear now, so that's kind of fun.